New information today on the vaccine distribution front is highlighting what health officials believe must be done to save the most lives.
KRDO News Channel 13's Jen Moynihan is live in our newsroom to explain the science behind the recommendations. Jen.
Heather Lauren, researchers at CU Boulder say the data speaks for itself when it comes to prioritizing people over 60 and doubling vaccine rollout. Leaders in Colorado and across the country aren't taking it for granted either, already implementing some changes. As Colorado continues its push to vaccinate seniors over 70 by the end of February,
saving the most lives, ending the public health crisis as quickly as possible. That's why the focus on 70 and up.
A new study conducted by researchers at CU Boulder is detailing the science behind the state's vaccine strategy.
This question of how the vaccine should be rolled out and maybe who should be first in line is one that we can answer with intuition.
University professor and researcher Daniel Larimore says intuition also points to other groups with high exposure risks like frontline essential workers.
And when intuition gives you two opposite recommendations, that's a great time to actually use a mathematical model to help you make a decision based on facts.
He and his team created several models to study distribution strategies across countries based on contact, also divided by age, separating older adults from children, teens, and those between 20 to 49.
And we ended up with this conclusion that in the vast majority of scenarios, prioritizing those adults 60 plus most minimize mortality.
Larimore says doubling vaccine rollout speed in the next few months could also save thousands.
The rollout speed really does matter. You can save a huge number more lives if you speed up vaccination.
Based on the data, Larimore says it's why Governor Polis and even the new Biden administration have recently shifted greater attention to rollout speed.
It's freed up the extra 40,000 doses for a total of about 120,000 first doses that can be distributed this week.
However, Larimore admits there's still not enough data available to rule out other issues that could come into play.
We don't yet know how well these vaccines that are on the market today are going to block transmission. And that's going to be something that we'll have to follow the data on.
Well, current CDC guidelines recommend vaccinations for people at least 65 and older. But Polis says moving to that next age group depends largely on supply within the next few weeks. In the newsroom, Jen Moynihan, KRDO News Channel 13.
Jen, thanks.